Now let's take a look at some of the significant health stories that are making headlines. ABC News medical correspondent Dr. Darien Sutton is here to break them down for us. Thank you so much for being here, Dr.
Good morning.
Sutton.
Happy to be here.
So there's a new study about health dangers for overweight teenage girls and young women that they could face later in life.
Yeah, an important study to break down. So this is a large study, over 10,000 participants spanning over 50 years. And they found that for teen girls, having obesity at the age of 14 was associated with more than almost double the risk of having a stroke before the age of 55. And that increased risk was not seen for teen boys.
Wow.
Really interesting. Also, more states are legalizing and decriminalizing marijuana now, and we're learning more about the impact on women and heavy cannabis use.
Yeah, so this is also an interesting study. It looks at women and heavy cannabis use, qualifying that as more than 100 uses during their lifetime. And it found specifically for women had a disproportionately increased risk of death secondary to cardiovascular disease. One big factor here, however, is that the increased risk seemed to only be for the women who had chronic disease, for example, diabetes, high blood pressure. So that gives some idea that this may be more of an association between cannabis use and worsening chronic disease rather than in patients who didn't have any at all.
Also, that definition, you said 100 times that they've used it throughout the course of an entire lifetime, and
That's
that was
what they
considered
qualify.
heavy.
Yes.
Okay.
Yeah, and that can be variable from person to person, obviously. And also, it's important to understand the patient population itself when you're trying to make recommendations. We've long known that cannabis can be associated with an increased risk of heart disease, but the question is how much? And so studies like this are really helpful to get the ball rolling, but again, they can be complicated with medical histories.
And I want to say, Whit, that I appreciate you bringing that up because I thought that too when I read it. I was like, 100 times? Like, that's a big population.
Not here to judge.
Absolutely right. There's also an interesting new study showing that lifestyle changes may improve symptoms in Alzheimer's patients.
I think that these studies are helpful. This study is actually a smaller study, but it does reveal some similar reports or findings from larger prior studies. So it found that for patients who had Alzheimer's disease, changing lifestyle modifications like increasing moderate exercise, stress management, and also focusing on a plant-based diet, it found that they had a slower progression of their Alzheimer's disease. When they looked at their cognitive tests and biomarkers in their blood, they found that patients who did these lifestyle modifications had better numbers. And so that helps to allude that having important lifestyle modifications is helpful aside from medication to prolonging life and quality of life and reducing risks from dementia.
Very interesting.
Yeah, and really hopeful.
Incredibly hopeful.
Study there.
Yeah, things that we can do now to improve our health later.
100%.
Yes.
An estimated 7 million people living with Alzheimer's. It's expected to double by the year of 2060. So making sure that diet, exercise, sleep are prioritized, and also making sure we manage our blood sugar to keep our brains healthy is really, really important.
There you go. Got to get it right, get it tight.
In less than 100 times.
I don't think that phrase is part of the study. Thank you, Dr. Sutton.
Of course.
Appreciate it, as always.